when should we have our first ECG done? For anyone who is a young guy, when should he have a first screening ECG done? Even if he is not having any cardiac pain or any symptoms, should we get a baseline ECG done?
I think ECG is such a simple test. So, I think generally we would say I do have an elaborate test. When we do, so we see the cost effectiveness ratio and whether what kind of, X-ray, there is an exposure to, on X-ray exposure to the body, whereas on ECG there is no harm in getting it done. So, if there is some indication even in the children, we can have an ECG done even in the children, like if they have palpitation or feeling of heartbeat, or if their heartbeat is too fast or too slow. So first thing is actually examine a patient. Doctor should examine a patient. If they find an abnormality in the pulse, too fast, too slow, irregular, should get an ECG done. I won't advise that a person should just go on his own or her own and get an ECG done. I think consult your physician, let him examine or her examine you, and then if they find any clue, ECG is a very simple basic test, it can be done right from there, and some clue can be done. ECG is not an absolute, no test is absolute.
It's not diagnostic. Absolute diagnostic.
Yeah, in certain situation it is very helpful. We very often do I had chest pain and next day I went and got an ECG done and ECG was normal, so I'm fine. Okay, doesn't mean anything.
It does not exclude that you don't have a heart disease 100%.
So every test has its own limitation, and it is only useful in certain situations.
Its own false negative ratio and false positive ratio.